A couple thoughts on the shoulder. The more patients that I see, athletes or non-athletes, I think it's more about range of motion than strength for keeping them healthy. There's a space here between the femoral head and the acromial arch there. And when that space gets decreased, the rotator cuff gets compressed, which goes right through there. I had a professional baseball player I saw this offseason, played for Texas Rangers, and he had offseason shoulder surgery. And he wasn't doing very well, so the doctor told me to take a look at him. And his range of motion was horrible. I mean, this guy's a professional athlete, seeing some other people, and they were so focused on strength. And strength is a great component. Strength and stability is great. But his range of motion just wasn't that good. He couldn't throw a ball. When professional athletes or your athletes are throwing a ball or spiking a ball or serving a ball, muscles get tight. You go for a hike for 5 hours up the mountain, the next day you're usually going to be a little tighter. And that tightness causes things to get compressed. I'm a big proponent of a little bit of stretching after a sporting event, a really hard practice, a really tough game. You can spend 1 minute stretching the shoulder or the knee. It's that much more preventative for any kind of injury that way. I find the athletes that do just a teeny bit of stretching right away after, they're a lot quicker to respond. They can get their space in the right appropriate amount without getting tight over time. So to me, I'd echo their sentiments, but keeping that range of motion, a little bit of stretching afterwards, keeps it good. So we're talking about the knee is our next slide, how to keep the knee healthy. The knee's trickier for female athletes. For some of you guys probably all know this, but there's a huge epidemic of ACL injuries for the young athlete. Just had a high school girl who tore her left ACL as a freshman, just tore her right ACL as a senior. And girls are very predisposed to it, so she missed 2 of her varsity seasons, or 2 of her high school seasons because of an ACL. I think the single best thing you can do, and I've talked about orthopedic surgeons, I've talked to trainers, I've talked to docs, and my standpoint as a physical therapist is preventing that knee from coming in. If you see any of your athletes with that knee coming in, that is the biggest hallmark for ACL tears, for patellofemoral problems that can be corrected easily. And that's just an awareness. How do you fix that is, coaches have to be aware of it, the players have to be aware of it, and if they can maybe just look in a mirror once in a while, like that's bad, that's good, just a few degrees. I mean, the difference between this and that is the player's season, possibly their career, possibly their articular cartilage when they're 40. So to me, I have a heavy passion about this. Like any girl that does this that I see, I have a huge knot in my stomach, and I just want to go and just tell them. But then I'll probably be some creep, so I don't do that. But I'd like to, because I'm so passionate about that. So the angle of the knee, and the second thing for knees that I really stress is that soft landing. Sometimes females tend to land very rigid with no cushion at all. And from our physics class that we've all taken, that's just too much force generated. If you can distribute that force over time, there's a lot less joint reaction force. So, we tell them land like a ninja. If you can land softly, land like a ninja. If one of your top hitters has a lot of constant knee problems, you just tell them to land a little softer so we can't hear it. I think there's a lot of success you can do from that. Did you have a question?
I have a question. So my question is, so you see an athlete, so like they come see you and they're about to pull a valgus knee. Do you have them do strength training or just jump training?
That's a great question. The question is, if you do have valgus, what do you do about it? I think if you can strengthen, particularly the hip abductors. Females tend to be more quad dominant. They have a lot of quad activation, but not very good hip abductors or hamstring work. So I think strengthening those muscle groups are great. But I think, in my mind, 80% of it is just knowledge. If you just are aware that when you do this, it's a bad thing, go to a mirror, have them jump off a box and watch it and make sure they're doing it. It's pretty fast how good they can get it. I mean, so as far as, general strengthening, does it prevent ACL injuries? Maybe I'll ask, Jim and John on that. But from my standpoint, it's more the neurological pattern. If you can train it correctly, that's good. And if you can train it from 12s and 13s, 7, they're good their whole life. Just have them aware of that. So much of everything is just being aware of what's good and what's bad. Calling on anything on the injury.
And the research tells us that the female athlete is about 8 times more susceptible to tearing their ACL than the male athlete. And Doc Spevak, as he explains, it's mainly from that knee kind of moving inward into that valgus, that knock knee position that is the mechanism of that injury. Whether it's landing or pivoting and letting that knee kind of cave inward. And it's most of the time it's a non-contact injury where it is about the mechanics of movement that are really the main problem. So simply just patterning that change, developing that habit, the proper mechanics of movement can really help prevent that injury from occurring in the future.
I really train a lot of the decelerization of the jump, because really when you're jumping off a box and you can see them land, and I know that's the key component, that is really where the athlete, as I've seen, really gets hurt, because the knee will move and then you got the force coming down with it. So that's where the knee's really going to have problems. And that's just a kinetic chain issue, and that's why we need to train. I really look from the ground up. That's why I really use a lot of different things there. So it really depends, but I really think with the knee, you got to train good mechanics from the start, and it really becomes a lot of balance and flexibility issues, and once you can train that, you can move on. But I really try to not be as aggressive as possible with weightlifting, because so many of these young athletes need the balance and the flexibility to be able to do certain movements. So